OET friends, I'm Dr. Arshnoor from DR.ARSHNOOR'S OET Institute. I've started a series of OET role plays discussion, and today I'm going to discuss an important topic of OET speaking. First of all, thanks Mahira from where I have got this role play task. I'm using your role play task. Thank you so much for allowing me for this. So let's start with this. I'm going to explain you how a role play is to be done. We have 5 minutes for a role play to do, and we have 3 minutes preparation time. For the task completion, we have 5 minutes, and for the task preparation, we have 3 minutes. This means 8 minutes total we have for that task, total role play task. 3 minutes are very crucial, as I've already made one of my video on the same YouTube channel that has explained you how to utilize 3 minutes to play your role play in a proper way. In this, I'm going to explain you that after 3 minutes, when you are going to play this role play, how you have to do, what considerations are to be kept in the mind, and how can you do it in the best way to score the highest score. First of all, we have 3 parts. In every role play, we have 3 parts. This is how to introduce yourself, or I'm talking about the nurses or the doctors, and how to address the patient. This is the first part. This means the second part is to gather the information, and third part is to convey your message or give remedy, solution to the patient. There may be the patient directly, or it might be some attendant of the patient. If the patient is elderly, the son or daughter of the patient can be talking to you, or if the patient is young child, in that case, his parents might be, or it might be some other person. Now, in this role play, I'm directly talking to the patient. Nurse role play, this is, and nurse, there is a patient with acne who has come to you, and he or she. Now, one thing again to be considered. Suppose you have clearly mentioned the gender of the patient. So, do not see the gender of the interlocutor at that time. Suppose it's a female patient, you have to assume the interlocutor as a female patient. Regardless of the gender, you have to start your role play and convey your message in the same way. Do not get messed up with this. Suppose the interlocutor is female and the role play patient or the person is male, you have to address the interlocutor as a male. In this, we don't have any particular gender, but I'm considering it to be a female because females are more concerned about their beauty and acne problem. Otherwise, this is quite common in the males also, but I'll consider this the female. Now, the first part, that is how to address the patient, that is community health center, and the patient has come to you first time with the problem of acne. You may start the topic like, hello, I am. So here you have to tell about the name. You have to introduce yourself. My name is Dash and Dash, and I'm the community health center nurse, or I'll be your attending nurse today. How may I help you? Then the patient will tell you that I have come with the problem of acne. Then you have to ask another question, that is, how would you like to be addressed? The patient will tell you that my name is Jenny, or any name the patient tells you. Then you may start with the role play in the same way. My name is Jenny, and I have come with a problem of acne. So then your questions, as it is already mentioned in this role play, it's a very simple role play, and it's given the direct directions. See the task, find out the patient's reason for the visit. I have already done that. Then collect details about patient symptoms. For example, onset, location, any triggers, and accompanying discomfort. My questions will be, when did you first see this, or when did it start? This is onset. So the first time when the patient saw this acne on her face. Then second is, so this is location. I've already told that it might be somewhere else, but 95% of the patients have acne on their face. Then location. So particular location, it may be on the forehead, it may be on the chin, cheeks, upper lip, lower lip, anywhere else. So then any triggers means anything that was on the condition. If it is by applying something, going to the dust, or using some soap, it might be while frying or doing cooking. So there might be any triggering factor which worsens the condition of the patient or which becomes a cause of the acne. Then any accompanying discomfort. For example, if the patient has the acne which does not have any inflammation, this means a simple acne, the patient needs only the treatment for that. But sometimes there might be some discomfort like pain, pus formation, and even the surrounding area that is inflamed. So in this way, these are the accompanying discomfort along with acne. Now go with the next part, that is explain what acne is. Now this is the role of the nurse. First of all, she has gathered this information by asking these questions to the patient. Then the second part is to give the information or so first is the information gathering, then information giving. So you have to explain what acne is. As in this case, I'll tell that acne is a common skin condition, as it's already mentioned. So you are a nurse and you're a medical professional, must be knowing that what is the reason for the occurrence of acne. Actually, there are sebaceous glands which are producing oil to keep the skin moist. When these sebaceous glands, they start uh, producing more oil, and sometimes this oil that that is deposited on the pores by any dust or dead skin cells or anything else, and the pores are blocked, due to which pus develops, acne is formed, and if it is a severe condition, in that case, the pus formation is too much and it is very painful. So this was the reason for the acne. What acne is, as it is mentioned here, common skin condition caused by clogging of hair follicle with oil and dead skin cells, appearing pimples, blackheads, or whiteheads. These are all the definition of the acne formation, and we can tell or explain the interlocutor who is playing the role of a patient there. Then next part is provide acne remedies. Now, first part, we asked a question, then we explained what acne is. Third part is how to treat it. As it is given that reassurance about the acne, you have to tell Jenny, be comfortable, and as it is a treatable condition, don't get alarmed. So it is a treatable condition and it is quite curable. You will get relief from acne by adopting the measures which I'm going to tell you right now. Be empathetic with the patient, that I can understand how difficult it is for you to cope with this. But be assured that it is a curable condition and you'll get relief from these by undergoing all the remedial procedure which I'm going to explain you right now. In this way, you are comforting the patient. Then it is how it is to be done. They have mentioned that maintain healthy lifestyle, balanced diet, overall skin health, limit greasy and fatty food. In this role play, 90% things are already given to you, and you need not to put pressure on your mind, because this is a very simple role play which I have chosen, and it is explaining each and everything. All the directions are given to you in a straightway manner. Now you have to tell Jenny, first of all, my strong recommendation for you are to avoid eating fast food, outside food, which is full of fats. Do not use greasy things. For example, cakes, pastries, or where the oil or cream is there. Then third is avoid using, or you may say that don't eat fried food or avoid eating fried food. Then the second part is healthy lifestyle. Healthy lifestyle means eat nutritious food and do some exercise. Do not keep on lying on the bed all the time and apply different type of the creams on your face. Then it is balanced diet. Already I've explained it to you. Overall skin health. You have to keep your skin clean and tidy. It is by some good face wash. Use good face wash to clean your face, and it should be kept clean and dry. Do not apply excess moisturizers cream on your face. Then the third part is gentle cleanser. So I have already told you that you may use a good skin care wash, soap, or face wash. Avoid excessive scrubbing. This is again a crucial part here. That is sometimes the people are in a habit of scrubbing their face, and it might lead to severe consequences in case of acne. Moisturizers, these are not to be avoided much. Avoid, because already we are telling that there is excess formation of the oils on the skin. And if the patient is using a moisturizer, again, they will block the pores of the skin. Those are already filled with the excess oil from the sebaceous glands. And in this case, when there will be clogging of the pores, it will lead to acne or the mushrooming number of the acne there. Avoid picking up and squeezing pimples. People are in a habit of squeezing the pimples because they feel that pimples can be eliminated or could be treated if they squeeze the pimple and they bring out the pus inside. But it will rather worsen the condition, because when you are squeezing or when you are putting pressure on the pimples, so they'll be injured. This area will be injured and it will develop into a wound, which will take much time to heal afterwards. Then reassurance for the acne, I have already given that. Now, one thing very important, that there is no particular instructions to follow the same pattern as it is given in this. As I have used this in the beginning, that be assured that it is a treatable condition, or Jenny, be relaxed. This is a treatable condition. You will get relief from the acne very soon by applying all these measures or adopting the measures which I'm going to tell you. So I have already covered this part. Now come with resist use of antibiotics. That is example. Severe cases of acne, discuss with pharmacist for skincare products, mild soap, etc. In the severe cases, when the inflammation is too much there, the acnes are pus-filled, there we need to apply antiseptics and to eat antibiotics, because the injuries or the wounds are only healed when antibiotics are used. So here, if the severe condition is there, if the acne are bigger in size, painful, inflamed, in that case, antibiotics are required. And you have to tell Jenny, first of all, the doctor has prescribed you. One thing important, nurses, you are not supposed to give prescription of the to the patient. So here, that's the reason they have given that discuss with the pharmacist. So you can say that, Jenny, you need to take some antibiotics, and you can contact the pharmacist, discuss with him or her, and according to the recommendation, you should start taking some antibiotics to relieve or to get these pimples cured. In this way, we can do this role play, again, I'm going to explain it to you that first of all, we have three parts. First, introductory part, that is, you have to explain about yourself, introduce yourself. What is your role there? And second part is you have to address the patient and ask the problem of the patient. We have 5 minutes in a role play and 1 minute that should be given for the introductory part, introducing yourself and asking about the patient, his needs, his purpose of the visit. May I ask that what brings you here? How may I help you? What's bothering you at the moment? Then the second part is information gathering. As we've gone with that, the onset, the location, any triggers and accompanying discomforts. So this was the information gathering part. Third part is information giving. Information giving means you are giving the solution to the patient. It may be some direct measures, some medicines, treatment, or it may be some procedures. It may be that you are giving some remedies, as is in the case of they have given advice, a piece of advice that is given to the patient to get relief from the pimples. Avoid greasy things or eat fat-free food, and you may add that avoid eating sugary contents. Second part, keep your skin clean and dry. Do not scrub it. Less uses of moisturizer or avoid uses of the moisturizer. Do not squeeze your pimples. These are all the remedies or the measures you have told the patient to get relief from the acne. At the end, you have given a solution that you have to use antibiotics, and you can contact your pharmacist to suggest you good antibiotics for this problem. This was all about a role play, and you can do this role play divided in three parts, five minutes, 1 minute for introduction, 2 minutes for the information gathering, and third part is for information giving. Sometimes the students, they start giving advice immediately after they hear or they listen to the patient's problem, but this is wrong. First of all get together the whole information, all the points, then you can rephrase that, giving all the information to the patient or repeating the information given to you by the patient. Then you have to give the remedy or the solution part. In this way, you can do this role play. Hope this was so useful for you. So one what I can say, request from my side or recommendation from my side, that you haven't subscribed our channel yet, subscribe it right now, as it will be quite beneficial for you in the future, as I'm going to upload some of the videos by what the explanation of the rule plays and the writing part, and giving the tips and tricks on the listening and the reading part also. I'm releasing my book, track OET at first attempt, which will be releasing which is under publication at this time, and this will be on the Amazon, available on the Amazon in the month of January. So I'm sharing much of the content of my book in this series of the speaking part, speaking OET, and it is going to help the doctors and the nurses and other health professionals also. If you like this video, do not forget to share and like, because it will boost up my confidence and I will prepare more videos to facilitate you. Stay connected, happy learning, and let's meet again with the new video. Thanks for watching. Stay connected.